This video is going to focus on the purpose of screening and why cervical cancer is such an excellent disease to screen. Firstly, let's have a look at Wilson's criteria for screening. So, according to this criteria for screening, the disease needs to be an important health problem. It needs to have a known natural history. It needs to have a latent phase. It needs to be easy. The screening itself needs to be easy to perform, sensitive and specific. The treatment needs to be more effective if it's started early. There needs to be a clear policy on who gets treated, and diagnosis and treatment needs to be cost effective. There also needs to be continuous case finding. So let's look at how cervical cancer measures up to that. Cervical cancer is the second most common cause of cancer in women in South Africa, and it's the most common cause of cancer deaths. Yes, we do know about the natural history, and it does have a long latent phase, which is that's what you're looking at when you get a pap smear with L-cell or H-cell as the result. That's part of the latent phase of cervical cancer or precursors to cancer. The screening is very easy and quick. It only takes 5 minutes to do a pap smear. Treatment is definitely more effective if it's started early because a late diagnosis results in much higher mortality. All women in South Africa are offered treatment for cervical cancer, and we'll talk more about specifically who and when women can get pap smears as part of screening for cervical cancer. And it is much cheaper to treat cervical cancer in the early stages. So, who do we screen for cervical cancer? In South Africa, women get three free pap smears in their 30s, 40s, and 50s. So ideally starting at age 30. For HIV positive women, they get annual screening. And this is really aimed at sexually active women because women who are not sexually active have a negligible risk of getting cervical cancer. All right, let's have a little look at the natural history and the pathogenesis of cervical cancer. And we're going to start by looking at the transformation zone of the cervix and what that is. So you can see here, this is a picture of the cervix of a premenarchal woman, a girl. So you can see there's the squamocolumnar junction over there. Up here in the endocervical canal, that's all the columnar cells. And here on the ectocervix, there are squamous cells. This is because the vagina has a different pH and is a different environment to the endocervical canal. So the cells need to be different to cope with that environment. Then as the woman goes through puberty and begins or enters into the reproductive phase of her life, there are some changes. The cervix swells, the endocervical canal lengthens, and part of the endocervix gets pushed outwards so that it protrudes into the vagina. So the original squamocolumnar junction, which was there, has now moved here, well into the ectocervix, and this area between the new squamocolumnar junction and the original one is called the transformation zone. So what happens to the cells in the transformation zone? Well, they undergo metaplasia. This is when one mature cell type turns into another mature cell. It happens during the reproductive stage of life in younger women, and it stops at menopause. And there is a high risk of dysplasia in these cells. What contributes to this risk of dysplasia? HIV does, smoking does, and also women with a large estrogen window. So women who are on combined oral contraceptives, or women who have had many children or have breastfed for a long period of time, have had a narrower estrogen window and they are at less of a risk. And another big contributor to dysplasia is HPV, human papillomavirus, typically types 16 and 18. It's spread by sexual contact or just skin-to-skin contact, and condoms prevent 60% of transmission. That's not that high. That means 40% of women can still get HPV despite good condom use. It usually clears by itself. Obviously, in some women it doesn't, and then it can progress to cervical cancer, and it can affect the lower GIT, the anus, esophagus, and mouth. But the most common area that it affects is the transformation zone here, because it's already undergoing metaplasia.